things even in my body. What would have happened if I didn't make it to the doctor on time? It is important that we take our health seriously. I know that we need to make money. I know that we need to be to connect with family. But once you're down, you're down. There's absolutely nothing you can do. It's just like a flat tire. You know, you're going somewhere, your tire is flat. There's absolutely nothing you can do. It's either you fix the problem or you find an alternative. And here, the only alternative you have is fixing the problem. So yes, welcome to the Mind and Body segment of the Midday Extra Show. Today, we are talking about malaria. Right, we have two segments of conversations, but the first, we're talking about malaria, seeing as, you know, it's the raining season and these things are prevalent at times like this. So it's important that we get to refresh our minds again on what we need to do, what is happening, what is malaria, what are the symptoms, the causes, the treatment, and all of that. So please stick with us here. I'm not alone in the studio, of course. I've got two professional, beautiful ladies by my right and another at my left. I have Dr. Olubumi Ojelade, and she is from Breakthrough Action Nigeria. She's the program officer for malaria. So trust me when I say that you are in good hands. She has all the information that you need to know. And then I'm also with Tessie Nongo Maina. I got it right. Yeah. Give it up for me. She is the health communication specialist, Network for Health and Equity Development. So together we'll be having the of course, you know, it's Mata. We'll be having the conversation together here. But let's go on. What is malaria? Let's start with Dr. Olubumi. What is malaria?
Thank you very much. Thank you for having me in the studio this morning. Malaria is so popular and it's so common. You hear it everywhere. But malaria is a disease. And you know, the moment you hear the word disease, it means you are not in the right state of health. Of it's a disease condition, no matter how popular it may be. And it is a disease that is caused by a parasite, Plasmodium. Okay. And it is only caused by the bite of infected female Anopheles mosquito. Obviously, when you have malaria, you will have certain signs, you will have certain symptoms. You won't feel good. One, you may have a high temperature, you may have chills, you may have some stomach ache, you may vomit, you may have headache. And these are some of the very common signs and symptoms of malaria that you would observe, and then you think you have malaria. But I must mention, before you could actually confirm that you have malaria, because most times when people have fever, that is when you have high temperature. People usually conclude, almost everybody in Nigeria has become a doctor or a nurse. They'll say, oh, you're not looking good, you have malaria.
Straight up.
Having the fever does not mean you have malaria, even though it is a common symptom for you to observe. You only know you have malaria when you get tested. You can be tested. There are two major ways to be tested for malaria. We have what we call the malaria rapid diagnostic tests. And we also have the one that your blood sample will be taken to the laboratory and it will be checked under the microscope. We call that microscopy. So when you have malaria, the health professional will be able to read. It is the results from this tests that would tell whether your fever or the other symptoms you have, they are caused by malaria. So, and when you have this, then it will be recommended for you to be treated. And the most effective treatment for malaria in Nigeria today is ACT, artemisinin-based combination therapy. It is a medicine that you'll be given, and this must be completed. I must emphasize, because most times when we take our medicine and we feel a bit all right, we stop taking our medicine, which isn't right. And these are ways, but this is malaria. Remember, for emphasis, not all the symptoms that we have, because most of the symptoms are common, and having other disease condition could also make you have such symptoms also. You get tested, and once you're positive, your result is saying you have malaria, you'll be treated. Otherwise, if it is not malaria, other tests will be recommended, and other whatever the situation may be, then you'll be recommended for other treatment.
Right, people, not all fevers are malaria, because we are quick. Don't drink agbo. They told you ACT. I hope you're listening to that as well. Now let's go to Tessie Nongo. What and who is at risk of malaria?
Okay, as she said that malaria is passed by the female Anopheles mosquito, that Plasmodium.
Yeah.
So we should say that anybody who that mosquito can access is at risk of malaria. So it's important for us to know that because the Plasmodium parasite, it's not going to be affecting animals.
Yes.
You know, it means human beings exposed to this mosquito bite are at risk. Men, women, children. But the vulnerability level is different. You know, women who are pregnant are more vulnerable, and it has an impact on the unborn child. That's why when you go to clinics, they emphasize that pregnant women should sleep under treated insecticide treated mosquito nets. So if you are in Africa, if you're living in a place that is waterlogged, where you have mosquitoes breeding, you are at high risk of malaria. You know, and if you're sleeping under without the mosquito net, you are also at high risk of malaria. The challenge is that you see it more with children and women, because for children it's difficult to get them to cover their body. It's difficult to, you know, so the more their bodies are exposed to these mosquito bites, the more they get you know, infected by malaria.
Mosquito treated nets, they have told us that. But now let's move to Dr. Olubimi. You see, why I like today is because I have variety of people to talk to, and I have variety of people to ask, you know, draw from their pool of knowledge. Now, there's this thing everybody says, that when you're your AA, and at a time like this, you will most likely break down. Anybody who is AA now, they're already prepping their mind somewhere to say that they'll have malaria, most likely do. Now, is this the truth? And if it's just a misconception, if it's true, why are they vulnerable?
All right, thank you very much. I'd like to take it right from her. She mentioned that every human being in Nigeria, in a place like Nigeria, because Nigeria is an endemic to malaria. I mean, malaria is very common in Nigeria. Is vulnerable to malaria, irrespective of your genotype. And she also mentioned that especially women that are pregnant and children under 5, when it comes to vulnerability to malaria, the most vulnerable people, everybody is vulnerable, but we have different risk of vulnerability. The most vulnerable people, they are the children under 5 and the pregnant women. And this does not have to do with your genotype. It's because their immunity is lower at that point. But it's also important that all of us, irrespective
that we have affinity, you know, vulnerability. Yes. Now, what treatments are available for malaria?
All right, like I mentioned earlier, when it comes to malaria, we have 2 types of malaria. We have the severe malaria and we have the uncomplicated malaria, which is the very common malaria. For the very common malaria, the uncomplicated ones, the most effective treatment is the treatment with artemisinin-based combination therapy, also called ACT. That is the most effective treatment. This will also be treated appropriately according to whatever the issues may be at that point in time. The healthcare providers know what to do when it is a complicated or severe malaria.
All right. Now, we've seen many instances where people treat malaria and they've completed their dosage, but they still are down with malaria. What is the reason for this? Because sometimes they're like, I just took malaria drugs. Why am I still feeling like this? What's the reason for this?
All right. You just permit me to do a little, I'll still reverse a bit. So when people are treated for malaria and they still feel down, like they're not feeling quite well, they have to get back to the facility, to the hospital, and to be tested. You know, until we test, we don't know if it is malaria. But because most times we assume it is malaria. I've been taking my medications. I've even completed my medications. I took it away. It was recommended, and I'm not feeling well. It might be pointing to something else.
Okay.
So until the person gets back to the hospital, and then the person is tested and know, oh, is this still malaria? Because it may not be malaria. It might be pointing to other health conditions which would be treated according to the condition that it may be. But please, people at home, most times we get to sit down at home and get to treat ourselves. Some of us might even get to repeat the medication again, not knowing whether we need to repeat this medication. So it is important, if we have taken your medications and you're not feeling well, get back to the facility. You'll be tested, and if
malaria drugs.
So permit me to say this. Yes, we observe that there is a need for providers' behaviors change.
Okay.
Yes, it has been observed that it's practices in some places, but it is not the right practice. It is not the best practice to just treat people as a blanket. It is important, and that is why even people at home, when you get to the facility, when you get to the hospital and you have complaints, it is in your right to say, please, can I be tested to know what exactly it is. And if you are not, let's say you're just giving medication without being treated, you have the right to say, oh, please, I would like to be tested to affirm, to actually know what I'm being.
Yes, the doctor has completed the diagnosis and said, okay, I'm down with malaria, but I also need to run a test to be certain that I'm actually down with malaria. So do not be scared, do not be afraid. It's your right as a patient. After all, you're paying for the service, right? So do not be afraid to ask questions every step of the way. Now, before we move to how malaria is being prevented, I'm capitalizing on the treatment and the drugs as well, because many times people are of the opinion that this drug doesn't work for me. If I use this, it doesn't work for me. If I use that, it doesn't work for me. I have to use this particular one. Why is it so?
Thank you very much. So we have what we call drug resistance.
Okay.
However, before we can go into drug resistance at all, and also partly why we have drug resistance. Even if you have complaints, you've had an experience with a particular medication that seems not to be working for you. These are part of the things that you discuss with your healthcare provider. That, oh, I've used this medication before. This was my experience with this medication. It didn't work for me, or I have a complaint. And once they are able to understand all these issues that you've had in